Hi, this is Christiana, and she came in today with a chief complaint of this hollowing and darkening below her eyes. And so when we're evaluating, we're looking at where her skeletal structure is. So we see that, and then we see this dip, and then we see the orbicularis. And that's her biggest complaint, is this gap, the difference between the prominence of the cheek and the orbicularis. So our treatment today is going to be using Restylane L. We're going to use a cannula fill for the majority of it. It's going to be multi-layer. We're going to start all the way down on the periosteum and continuously layer up, and we're going to camouflage that. Now, we talked about why that area appears darker, and we used kind of the analogy of mountains and valleys. So if you have a mountain here and you have a valley here, and the sun's coming up over the mountain, it's going to be dark down there. So if you want to get light, you're either going to cut off the top of the mountain or you're going to fill up the valley. Mm-hmm. So we're going to do the last one. We're going to fill the valley because you're too pretty for us to cut anything off of. So we're just going to come fill in this valley, nice layered approach. We're going to get a little bit of swelling, but that's going to resolve over time, over the next couple days. She can use some ice for the next 24 hours, and that'll help quite a bit. But overall, pretty simple procedure, especially using the cannula. We'll just start laterally and then just serially inject our HA. Good. So the first thing we're going to do is see how long our cannula is, and then we're going to come up with our injection spot. So right about in this area, we'll just tap just a little bit. She already has topical anesthetic on. We'll make just a small little injection. Okay, not too bad, but that's going to be the majority of the pain that we're going to feel. Okay. And then, sometimes these are so teeny tiny, you have to make sure you're keeping your eye on it, or else you're going to lose it. So chin up for me a little bit. So now we're subcutaneously. And like I said, we're going to start off a little deeper. I'm going all the way down to periosteum. I'm going to put my finger here, protect your eye. Actually, go ahead and open your eye for me. Okay, and sometimes that just kind of helps us orient where we are. Always knowing where my tip is, and just injecting as we withdraw. And we're going to get all the way up into the tear trough. And just slowly fill. Not being overly aggressive, we can always go back and add more. And then fairly moderate massage just to make sure that there's no lumps and bumps. Again, now we're just somewhere between the orbic and the skin. Coming back, layered approach. How does this feel? Does this hurt?
No, not at all.
Good. So again, we're just gauging our distance. We're going all the way almost completely up to the medial canthus. So that's where my entry point is going to be. That's where my angulation is going to be. Good. So we're going to work our way up, knowing where my tip is the entire time. Feeling for the bone. I'm on the periosteum right now. I'm going to just gently, in a stepwise fashion, incrementally fill. Always filling on withdrawal, not on advancement. And really just filling in that valley that we talked about. That shadow, or the dark circles that people complain about are often caused by just the way that overhead light is casting. So sometimes for these little finer areas where we need precise control, I'll switch to the needle. Just gives a little bit more pinpoint control over small little aliquots. Okay. And this is just a little bit more superficial. But again, everything is nice and layered. So we are done. That's about a half a cc on each side. Go ahead and take a peek and let me know what you think.
Oh, that's amazing. Thank you so much.
Quite
that's really good.
Quite a bit of difference, right?
Yeah.
So just that little bit, just that little half cc, just to fill in that that valley makes quite a bit of difference.
I already look more awake.
Yeah. Great. And these little bruises here, these are going to heal up, pretty quick. They'll be gone in, the next day or so. We can put a little bit of ice under here if we need to. But overall, great case and happy patient.